Welcome to the deep dive. Today we're plunging into a topic that might seem really specific, but trust me, it has huge real-world implications for thousands of federal workers. We're talking about federal workers' compensation claims, specifically those, complex cases involving pre-existing degenerative conditions.
Right. Things like arthritis or back problems that were already there.
Exactly. Imagine someone, let's call her Maria, a postal worker, been doing it 20 years. She's got knee arthritis, it's been there. But suddenly it's not just aching, it's getting way worse.
Okay.
And it's not about one specific fall she took. The question is, did her federal job aggravate or accelerate that condition she already had?
That's the core issue.
So let's unpack this a bit. What does that really mean, work making a pre-existing condition worse? And how does the system even, understand that, validate it for someone like Maria?
Well, that's exactly our mission for this deep dive. We want to clarify this often, let's face it, complex world of the Federal Employees Compensation Act, or FECA, claims. And we'll focus right on how these work-aggravated degenerative conditions get recognized, how you prove them, and ultimately, how they get accepted.
Good.
So by the end of this, you, like Maria perhaps, will hopefully have clearer insights into the system. It's designed to support federal workers, after all, make sure they get the care and benefits they actually deserve.
Okay, so let's start with the basics. For Maria, for anyone listening, when we talk about these degenerative musculoskeletal conditions, what are we actually talking about?
We're usually thinking about things like osteoarthritis. That's the common wear and tear on joint cartilage.
Right, the knees, hips.
Exactly. Or degenerative disc disease in the spine. Even tendinopathy, which is basically chronic damage to tendons.
And these are conditions that, let's be honest, often just come with age.
Yeah, often do, yeah.
So how can something that's often just part of getting older also be considered work-related under these federal comp rules? That seems like a contradiction.
It seems like it, but that's where FECA's broad definition is really crucial. It basically says that any disease or illness that is worsened, accelerated, or precipitated by federal employment is covered.
Any. That's broad.
It is. So in Maria's case, if her mail-carrying duties, the walking, the lifting significantly made her pre-existing knee arthritis materially worse, then that resulting aggravation is considered an injury that happened in the course of her job.
Ah, okay. So the aggravation is the injury.
Precisely. The Office of Workers' Compensation Programs, OWCP, they handle these claims. And they accept the aggravation itself, not the underlying disease.
So they wouldn't just accept osteoarthritis?
No. For Maria, they might accept aggravation of her right knee osteoarthritis. It's a subtle but important distinction.
Gotcha.
And it's also really important to know that FECA covers both acute aggravations.
Like a single event.
Yes, a single misstep that suddenly flares up Maria's knee really badly. And gradual ones, which are the result of repetitive stress over time, like Maria's years and years of walking her route.
Okay, so here's where it gets, really interesting for me. How do the doctors and how does OWCP actually identify that work aggravation? What are the red flags they look for in someone like Maria?
Well, clinically, it's often recognized when someone's degenerative condition just deteriorates way beyond what you'd normally expect, and you can connect that deterioration in time to their job duties.
So faster than expected aging, kind of.
In a way, yes. Red flags often include things like sudden or significant increases in pain or loss of function that happens during or right after work activities.
Maria's knee pain suddenly surging.
Exactly. Maybe after months of increased walking on her route, or maybe a sudden sharp pain doing a heavy lift she'd done loads of times before without issue.
Okay.
And sometimes medical imaging x-rays, MRIs, might even show objective worsening.
Oh, like you can actually see it.
Yes, like accelerated joint space narrowing in Maria's knee on an x-ray, or maybe new tendon tears showing up on an MRI that line up with her work exposures.
Wow.
We've seen some pretty powerful examples in cases. There was a postal worker whose repetitive keyboard and phone use was clearly linked to worsening degenerative disc disease in her neck. Or another letter carrier, 19 years on the job, constant walking, stairs, lifting it significantly sped up the cartilage degeneration in his knee and hip. His arthritis got way worse than you'd expect for someone, say, with a desk job.
So it's about exceeding the normal course.
Precisely. And the crucial element here, I can't stress this enough, is the medical expert opinion.
The doctor's report.
Yes, but think of the physician not just as diagnosing, but as almost like a forensic storyteller. They have to provide what's called a rationalized medical explanation.
Rationalized. Okay, what does that involve?
It means they need to detail with, scientific precision how specific work factors like Maria's years walking that heavy mail route or climbing stairs, maybe even a specific incident at work, caused a measurable worsening of her knee arthritis.
Measurable worsening.
Right, a worsening that exceeded the condition's natural course. They have to explain why it got worse because of the job, not just while she had the job.
That makes so much sense. It actually reminds me of this really compelling case I read about from 2025, I think it was. A doctor successfully explained how a forklift collision, it subjected the worker's spine to so much force that it actually accelerated degenerative spinal conditions beyond their natural progression. It caused real structural worsening. It wasn't just that the collision happened, but how it fundamentally changed the path of that existing condition.
Exactly. That's the level of detail needed.
So if Maria's doctor just writes a note saying, yep, her knee hurts, she works for the post office, that's not going to cut it, is it?
Not even close. It's just not enough to say a condition popped up during federal employment. The medical evidence has to connect the dots, show that clear scientific link between the specific work duties and the aggravated condition. Maria's doctor needs to build that bridge.
Okay, so building the bridge. Let's move to a really critical step for Maria. Actually filing her claim. Now, there's this big decision right at the start. Form CA1, traumatic injury, or Form CA2, occupational disease. That choice can feel kind of intimidating. Why does the form she picks matter so much for her claim?
Oh, it matters hugely. Choosing correctly between CA1 and CA2 is vital. It really comes down to the time frame and mechanism of the injury, as OWCP puts it.
Time frame and mechanism. Okay.
So a CA1 traumatic injury, that's for a specific event or incident during one workday or shift.
Like the forklift example, or maybe Maria twisting her knee on one delivery.
Exactly, or slipping on ice. Something that causes an acute, sudden flare-up of her existing arthritis. If you can point to a distinct accident in time, CA1 is the way to go.
And are those easier to get approved?
Generally, they can be simpler to adjudicate, yes. And importantly, filing a CA1 within 30 days. This is key. It can entitle the employee to continuation of pay, or COP.
COP. That's regular pay while the claim is processed.
That's right. For up to 45 days, it's a huge benefit if you're suddenly unable to work because of that acute injury.
Okay, so that's CA1. What about the other one, CA2?
Right. CA2 is for occupational disease. This is used when the condition has been worsened by prolonged or repetitive exposures over more than one workday.
So that sounds more like Maria's knee getting worse over years of walking.
Precisely. It perfectly covers that gradual deterioration from cumulative trauma, Maria's knee from years on her route, or maybe a desk worker getting tendinopathy from months and months of typing.
No single moment you can point to.
Correct. There's no single identifiable incident. It's the aggregate effect, the buildup from the job duties over time.
And these take longer to process.
They usually require longer investigation, because you need to document that whole history of exposure. What exactly were the duties, for how long, etc.
Okay, so the rule of thumb is,
if the injury or the bad flare-up can be traced to a single shift or event, use CA1. If it developed over time, more gradually, use CA2.
got it.
And it's also worth mentioning the time limits for filing are different, especially thinking about that COP eligibility for CA1 versus the general 3-year awareness window for filing a CA2.
That's a really helpful breakdown. Okay, so let's say Maria figures out, okay, my knee pain built up over years, it's cumulative, she's going the CA2 route. Now, what does she actually need to do? Putting together the claim, it feels like the burden of proof is really on her, right?
You're absolutely right. The burden is on the employee to establish all the essential elements of the claim.
So what's the blueprint for gathering the evidence she needs?
For these work-aggravated degenerative conditions, successful claims really need 2 key sets of evidence. First up is factual evidence, basically documenting the work activity.
Her job duty.
Exactly. Maria needs to provide a detailed, specific account of her job duties. What did she do? For how long? And, crucially, how did her symptoms get worse in relation to those duties?
So not just, I carried mail. More like,
for 20 years, my job involved casing and delivering mail 8 hours a day, which included walking 6 to 8 miles daily and climbing, say, 50-plus flights of stairs.
Yeah.
Specifics paint the picture.
Okay. What else helps with that?
Things like official position descriptions, any ergonomic assessments that were done, maybe even witness statements from coworkers who saw what her job entailed. The goal is really to paint a clear picture of, what the job did to the body.
Right. Show the physical demands. Okay, that's the factual part. What's the second part?
The second piece, and you could argue it's the most crucial, is the medical evidence. specifically the diagnosis and the causal medical opinion. And this has to come from a qualified physician.
Okay. What did that entail?
Well, Maria needs a firm diagnosis from her doctor, both of the underlying degenerative condition like osteoarthritis and its work-aggravated state.
So 2 parts to the diagnosis.
Kind of. For example, the doctor might diagnose tricompartmental osteoarthritis of the right knee, but then add aggravated by increased cartilage wear due to occupational duties.
Ah, connecting it right in the diagnosis.
Ideally, yes. And diagnostic reports, x-rays, MRIs, they're essential to back this up. And if Maria happens to have older imaging from before the worsening, comparing old versus new can be incredibly powerful evidence to show that progression during her employment.
So getting back to that rationalized medical opinion you mentioned earlier, this sounds like the heart of the medical evidence. What does OWCP really want to hear from Maria's doctor here? It's definitely more than just a quick note or checking a box, right?
Oh, absolutely. You've hit the absolute core of the claim. A rationalized medical opinion it's the bridge the doctor builds between the job and the worsened condition.
Yeah.
It requires a really comprehensive narrative explanation.
A narrative. Okay, what needs to be in that story?
The physician has to cover several key points. 1, acknowledge the pre-existing condition. Describe what it is and what its natural expected course would be. Sort of like, yes, Maria had some baseline arthritis, and typically this progresses slowly with age.
Okay, set the baseline.
2, show they understand the work exposures. They need to detail the frequency, intensity, duration. I understand Maria walks 6 to 8 miles daily, carrying heavy mail, and has done so for 2 decades. Show they know what the job involved.
Got it. Know the job.
3, explain the mechanism of aggravation. This is the science part. How did those specific activities physiologically make the condition worse? They need to answer, essentially, would this worsening have happened anyway, just slower? Or did the work cause it to happen sooner or much more severely?
Like explaining how lifting increases pressure on spinal discs.
Exactly. That's a perfect example. Explaining how repetitive heavy lifting increases intradiscal pressure, which can lead to faster desiccation, the discs drying out and breaking down quicker than they normally would. That's mechanism.
Okay.
What else? 4, state the degree of certainty. Use standard medical language, like within a reasonable degree of medical certainty, shows confidence in the opinion.
Right. Standard phrase.
5, and this is crucial, differentiate the work-related worsening from the underlying disease. They have to clarify what part of Maria's current problem is due to the work factors versus what would have happened anyway due to natural progression.
Ah, separate the work effect from the aging effect.
Precisely. Failing to address that baseline versus the aggravated state, that's a super common reason for claims to be denied. We've seen ECAG decisions specifically point out when a physician did not address the natural course of the underlying condition.
Okay, very important. Anything else?
And finally, number 6, indicate whether the aggravation is temporary, like a flare-up that will calm down, or permanent, meaning the work has caused lasting damage.
Wow, that's a lot the doctor needs to cover.
It is. So, to summarize, a simple check mark on a form, it's just not enough. OWCP needs that detailed narrative report with all that supporting rationale.
And common mistakes are?
Vague statements, forgetting to discuss the pre-existing disease at all, lack of detail about the actual work, like an opinion that just says postal duties caused chronic inflammation and accelerated cartilage loss that got denied.
Why?
Because it didn't provide enough medical rationale to explain how the duties caused the aggravation, and it didn't detail the frequency or intensity of those duties. It needs to be thorough, well-reasoned, like a medical expert's legal brief almost.
Okay. That really clarifies the medical burden. Now, if we zoom out a bit, connect this to the bigger picture, what's the legal and regulatory foundation for these kinds of claims? How does that influence how OWCP handles them for someone like Maria? It sounds like there's a lot of, legal precedent involved.
Absolutely. The foundation is primarily the FECA statute itself. It defines injury really broadly to include any disease proximately caused by employment, and that explicitly includes conditions that are aggravated or accelerated by the job.
So it's right there in the law.
It is. Then you have the implementing regulations, which define key terms like occupational disease, temporary versus permanent aggravation, things like that. And the OWCP procedure manual guides the claims examiners internally on how to apply these rules.
Okay. But you mentioned precedent.
Right. Perhaps the most impactful day-to-day are the ECCAB decisions. That's the Employees' Compensation Appeals Board.
The referees, you call them.
Exactly. Think of ECK as the final word, the Supreme Court for these claims. Their decisions set the legal standards and interpretations that everyone else has to follow: claimants, agencies, OWCP itself.
What do those decisions emphasize for these types of claims?
Well, ECK has repeatedly reinforced the claimant's burden of proof needing those 5 basic elements for any claim. But critically, for aggravation claims, they hammer home the absolute necessity of that rationalized medical opinion. They've called it the sine qua non.
Sine qua non, Latin for.
Literally, without which, nothing. Meaning it's the absolutely indispensable essential element. Without it, the claim fails. Landmark cases really establish this, emphasizing why that reasoned explanation is the absolute make-or-break piece of evidence.
So the doctor's report is everything.
For establishing causation in these cases, pretty much, yes. ECCAB also stresses that the opinion must explain how those accepted work factors actually altered the course of the pre-existing degenerative condition.
Changed its trajectory.
Exactly. And you see this play out. Some claims get denied by OWCP and then upheld by ECCAB because the medical details just weren't there. But other claims, maybe denied initially, get accepted or sent back for another look by ECCAB if the evidence, especially that medical rationale, is strong and well explained.
Okay, that legal context is important, but let's bring it back to the individual. All this legal medical stuff. What does it really mean for you if you're a federal worker struggling with a condition like Maria's? Why is getting one of these degenerative condition claims accepted under OWCP so incredibly critical?
Oh, the implications are profound. Just huge. Firstly, and maybe most obviously, access to medical care.
Okay.
An accepted claim means you get cost-free medical treatment for that work-related condition. We're talking 100% covered, no copays, no deductibles, no time limits.
No time limits, even for chronic stuff.
Even for chronic stuff,
Yeah.
including long-term management, physical therapy, medications, even major surgeries like a joint replacement for Maria's knee down the line if needed for the accepted condition.
Wow. Compared to if it's denied.
If it's denied, you're relying on your personal health insurance, assuming you have it, with all its limitations, co-pays, networks, or worse, paying entirely out of pocket. For a chronic condition, that can be financially devastating.
Okay, medical care is huge. What else?
Secondly, wage loss and disability benefits. Acceptance makes you eligible for compensation payments if you lose wages because of the condition. Usually 2/3 or 3/4 of your salary, and importantly, it's tax-free.
Tax-free.
Tax-free. Plus, you might get that continuation of pay for 45 days if it was a CA1 claim. And potentially, down the road, a schedule award payment for any permanent impairment resulting from the condition.
Okay, so income protection. That's vital.
Absolutely. Thirdly, job security and leave restoration. An accepted claim offers protection from adverse personnel actions related to the injury. And you can even buy back sick or annual leave you used for the condition before the claim was accepted. Get that leave back on the books.
That's a nice benefit.
It really is. Fourthly, medical provider reimbursement. This is important for actually getting care. Acceptance means OWCP pays the doctors and hospitals directly. This removes the financial risk for them, making them much more willing to treat federal employees under workers' comp.
Ah, so doctors are more likely to take your case.
Generally, yes. If the claim isn't accepted, providers might be hesitant, worried about getting paid, or might try to bill you directly.
Okay. And lastly,
long-term support and case management. The claim technically remains open for the life of the injury. This means lifelong coverage for related medical needs. And you might get access to other resources like OWCP case managers or vocational rehabilitation services if needed.
so it really provides security.
Exactly. In essence, acceptance provides immense peace of mind. It lets you focus on your recovery, on managing the condition without the crushing stress of medical bills, and with the assurance of income support if you can't work. It's about securing your health and your future.
Okay, so given this high bar for getting accepted, especially for something as, nuanced as a work-aggravated degenerative condition, what are the proactive strategies? How can someone improve their chances of approval? What advice would you give to Maria, maybe her doctor, even her agency contact, to help her case succeed?
Yeah, that's the key question. There are definitely targeted recommendations for everyone involved in the process.
Let's start with the doctors.
Okay, for treating physicians, the absolute focus has to be on those detailed, evidence-based narrative reports we talked about.
The rationalized medical opinion.
Exactly. They need to explicitly review the patient's job description, show they know the work. They need to correlate their clinical findings with specific work factors,
All right.
like Mrs. Jones's prolonged kneeling on concrete floors, documented in her job description, caused repetitive microtrauma to her knee cartilage. This is evidenced by the rapid progression seen on her x-rays, going from mild to severe bone-on-bone arthritis in just 2 years, a rate far exceeding typical age-related progression.
Wow, that's specific.
That's the level needed. They must address how the current severity exceeds the expected natural course. Use objective evidence like imaging. Be clear and affirmative on causation. Use those magic words within a reasonable degree of medical certainty. And submit reports promptly. It's not just a medical opinion, it's really building a medical argument.
Okay, solid advice for doctors. What about the agency folks, the injury comp specialists?
For the agency injury compensation specialists or compliance officers, their role is really to facilitate complete and accurate documentation from the agency side.
How so?
Well, they can guide the employee on choosing the correct claim form, CA1 or CA2. They should submit a robust agency statement that accurately confirms the employee's job requirements and duties. If they have data on exposures like lifting frequency, chemical exposures, whatever applies, provide that. Ensure the agency submits its part timely. And, importantly, avoid disputing claims without a solid, factual basis. Their honest, factual confirmation of the job duties can carry significant weight with OWCP.
So be helpful and accurate.
Basically, yes. Be a facilitator, not an obstacle, unless there's a real factual dispute.
Okay. And what about claims managers or advocates, people helping the employee navigate this?
For claims managers or advocates, think of yourselves as the project managers for the claim. Your job is to ensure comprehensive evidence gathering. That means getting all the relevant medical records, especially any pre-existing ones.
Find those old x-rays.
Exactly. And identify and resolve gaps early. If you read the treating physician's report and see it's missing that crucial discussion of natural progression or details on work duties, request a supplemental report before OWCP has to ask for it. Be proactive.
Get ahead of OWCP's questions.
Precisely. Consider if a second opinion or a report from a specialist, like an occupational medicine physician, might strengthen the case. Leverage legal precedent. If you know a relevant ECT decision that supports the claim, cite it. And maybe most importantly, be persistent. Don't give up if the claim is initially denied.
Good, many are.
Many are initially denied, often because that medical rationale wasn't sufficient the first time. But they can absolutely get accepted on appeal if you go back and get that better, more detailed medical explanation. Persistence pays off.
That's really practical advice. And I guess just general best practices for Maria or anyone filing. Clear labeling on everything you submit, right? Be consistent and truthful in your accounts. And maybe fostering collaboration, getting the doctor and the claims person talking, or at least ensuring the doctor has the job description.
Yes, anything that helps build that coherent narrative. It's about anticipating OWCP's questions and building a rock-solid, logical case right from the start. Your claim file needs to tell a compelling story, and that story needs to be backed by undeniable facts and reasoned medical opinion.
So wrapping this up, it sounds like while these claims for work-aggravated degenerative conditions are definitely, medically tricky, and they demand really rigorous proof.
They absolutely do.
They can be successful under FECA. It just takes the right approach.
That's exactly right. The ultimate goal for someone like Maria or anyone in that boat is to clearly show that their underlying degenerative condition was materially accelerated or exacerbated, made significantly worse, or progress faster specifically because of their federal work duties.
And if you can show that.
If you can show that with strong factual and medical evidence, then that condition qualifies for the full protection and benefits under FECA.
Understanding these intricate systems like FECA and the very precise evidence they demand, it isn't just about navigating bureaucracy, is it? It's really about advocating for your own health, your livelihood.
It truly is.
So maybe a final thought for you listening out there. What aspect of your own work, or maybe even your personal situation, might unknowingly be influencing your body's natural progression? And thinking about Maria's story, what steps could you take now to ensure you're documenting that story effectively, just in case you